Did you know that some medications you take daily could be silently destroying your kidneys? If you have diabetes, your kidneys are already working harder than normal, and certain medications that seem harmless might actually be pushing them toward failure. Here's a little-known fact: your kidneys and digestive system are closely connected. A healthy gut can reduce the burden on your kidneys and help regulate blood sugar. But if you take medications recklessly without understanding their side effects, you might unknowingly be increasing your risk of kidney failure. The good news? There are simple ways to protect your kidneys without completely giving up medication. In this video, I'll help you identify 7 commonly used medications that could be damaging your kidneys in ways you never expected. Don't miss this crucial information. Make sure to like and share this video so more people with diabetes can learn how to protect their kidneys. If you haven't subscribed yet, hit the subscribe button now to avoid missing important insights that will help you naturally and effectively manage diabetes. 1. NSAIDs, non-steroidal anti-inflammatory drugs, and their risk to kidney health. Many people use NSAIDs like ibuprofen and naproxen for pain relief and inflammation reduction. However, few realize that these medications can harm the kidneys, especially for diabetics. How NSAIDs affect kidney function. NSAIDs work by inhibiting cyclooxygenase (COX) enzymes, which reduce prostaglandin production. Prostaglandins help dilate blood vessels and increase blood flow to the kidneys. When prostaglandin levels drop, small arteries in the kidneys constrict, reducing blood supply to the glomeruli, the kidney's filtering units. Research suggests that 1 to 5% of NSAID users may experience kidney-related side effects. Risks for diabetics. People with diabetes already face a high risk of chronic kidney disease. Using NSAIDs can further increase the risk of acute kidney failure. Additionally, NSAIDs can raise blood pressure and cause fluid retention, worsening heart failure risks in diabetics. A study in the New England Journal of Medicine found that NSAID overuse could reduce kidney function by up to 30% in individuals with pre-existing kidney conditions. NSAID usage recommendations. Limit use. Diabetics should minimize NSAID use, especially for long-term treatment. If necessary, use the lowest effective dose. Consider alternatives. Acetaminophen, Tylenol, may be a safer option for mild to moderate pain relief. Monitor kidney function. If NSAIDs are necessary, have regular kidney function tests and stay well hydrated to help your kidneys eliminate the medication. While NSAIDs can effectively reduce pain, diabetics must be aware of their potential dangers to kidney health. Understanding how these drugs work can help you better protect your kidneys. 2. Antibiotics and their impact on kidney function in diabetics. Antibiotics are essential for treating infections, but improper use or overuse can damage the kidneys, especially in people with diabetes. How antibiotics affect the kidneys. Certain antibiotics, particularly aminoglycosides like streptomycin, neomycin, tobramycin, and gentamicin, can lead to kidney failure within 7 to 10 days of use, with kidney-related side effects occurring in about 10% of cases. Streptomycin and neomycin have high toxicity, so neomycin is no longer available as an injection and is rarely used in oral form. Streptomycin is mainly reserved for tuberculosis treatment. Gentamicin and tobramycin pose a moderate risk to kidney health, but gentamicin is widely used and has the highest potential for causing kidney damage. Risks for diabetics. People with diabetes are already prone to chronic kidney disease. Taking the wrong antibiotics can increase the risk of acute kidney failure. Additionally, some antibiotics can damage kidney filtering cells or cause crystal formations in the urinary tract, leading to blockages and long-term kidney strain. Antibiotic use recommendations. Follow doctor's orders. Never adjust your antibiotic dosage without medical guidance. Always complete the full course as prescribed. Choose kidney-friendly antibiotics, if necessary. Opt for antibiotics with lower kidney toxicity. Vancomycin, for instance, can cause acute kidney failure if taken long-term, so close monitoring is required. Regular kidney function tests. Diabetics taking antibiotics should frequently check kidney function to detect early signs of decline and take preventive measures. Controlled antibiotic use is essential for kidney protection in diabetics. reducing the risk of kidney failure and other severe complications. 3. Diuretics. When water isn't just water. Many diabetics are prescribed diuretics to control blood pressure and reduce fluid retention. While they may seem beneficial, these drugs can overwork the kidneys and cause severe electrolyte imbalances. How diuretics harm the kidneys. Diuretics force the kidneys to expel excess water and salt through urine, relieving pressure on blood vessels and the heart. However, this also means the kidneys must work harder than usual. Excessive water loss can cause dehydration, making blood thicker, reducing kidney blood flow, and potentially leading to long-term damage. Additionally, diuretics can deplete essential minerals like potassium, sodium, and magnesium. These minerals are crucial for overall health and kidney function. When their levels become unbalanced, kidney function can gradually decline. Who should be cautious? If you have diabetes and take diuretics like furosemide or hydrochlorothiazide, be aware of dehydration signs, dizziness, muscle cramps, and fatigue. Dark urine or constant thirst may indicate kidney problems. Safer diuretic use strategies. Stay hydrated. Drink enough water, but avoid excessive intake at once to prevent kidney overload. Monitor blood pressure and electrolyte levels. Regular checkups can help detect imbalances early. Consult your doctor if you experience extreme fatigue or other unusual symptoms. Consider adjusting your medication regimen. Your kidneys are already working hard. Listen to your body and protect them wisely. 4. Proton pump inhibitors, PPIs, and their risk to kidney health. Proton pump inhibitors, PPIs, like omeprazole and lansoprazole, are commonly prescribed for stomach issues such as acid reflux and ulcers. While these medications effectively reduce stomach acid production, long-term use can have serious side effects, especially on kidney function. How PPIs affect kidney function. A study published in the Journal of the American Society of Nephrology found that PPI use increases the risk of chronic kidney disease by 28% and kidney failure progression by 96%. Notably, the risk is significantly higher for long-term users. Dr. John Cook, chair of cardiovascular research at Houston Methodist Hospital, described PPIs as undeniable harm in a pill because they suppress acid production throughout the body, disrupting normal cellular metabolism. Additionally, reducing stomach acid levels can lower absorption of essential minerals like magnesium and calcium, which impacts kidney function and overall health. How to use PPIs safely. Only take PPIs as prescribed and for the shortest duration possible to minimize side effects. Monitor kidney function regularly if long-term PPI use is necessary. Consider alternative treatments such as dietary adjustments, lifestyle changes, or antacids with fewer side effects. Being aware of PPI's potential risks to kidney health can help you make safer treatment decisions and reduce the risk of kidney failure in the future. 5. Contrast dye and kidney damage risk in diabetics. Contrast dye is commonly used in imaging tests to enhance scan quality and help doctors detect health issues. However, contrast agents, particularly iodine-based dyes, can damage the kidneys, especially in diabetics. How contrast dye harms the kidneys. Contrast-induced acute kidney injury, CAKI, is a serious complication that typically occurs within 24 to 48 hours after contrast exposure, with serum creatinine levels peaking around 5 to 7 days later. Studies show that CAKI accounts for 10% of acute kidney injury cases in hospitalized patients. Among diabetics with existing kidney disease, the risk can be as high as 50%. Mechanism of kidney damage. Iodine-based contrast dyes can cause kidney blood vessel constriction, reducing blood flow and oxygen supply, directly damage kidney tubular cells, leading to acute tubular necrosis, increase cellular dehydration, worsening kidney strain. Who is at highest risk? Diabetics, especially those with existing kidney complications. Elderly individuals, 70+ years old. Patients with chronic kidney disease. Those with heart failure, cirrhosis, nephrotic syndrome, or multiple myeloma. Prevention strategies. Assess kidney function before imaging tests by checking serum creatinine levels. Use lower osmolar or iso-osmolar contrast agents to reduce kidney damage risk. Stay hydrated by receiving IV saline before and after contrast exposure to maintain blood flow to the kidneys. Avoid kidney-toxic drugs, NSAIDs, aminoglycosides, cyclosporin A, for at least 48 hours before the scan. While contrast dyes are essential for diagnostic imaging, diabetics and high-risk individuals must take precautions to protect their kidneys. Proper preventive measures can significantly reduce the risk of kidney damage and ensure patient safety. 6. Laxatives, a temporary fix. A long-term kidney threat. As a diabetes expert, I've seen countless patients turn to laxatives for constipation relief, without realizing the potential dangers. Constipation is common in diabetics due to high blood sugar's effects on the nervous system controlling digestion. However, overusing laxatives can severely harm the kidneys, already burdened by diabetes. How laxatives can damage the kidneys. Certain laxatives, particularly those containing sodium phosphate, can cause dehydration and severe electrolyte imbalances. When the body loses too much fluid, blood flow to the kidneys decreases, reducing their filtering ability. A study in nephrology dialysis transplantation found that high-dose sodium phosphate laxatives increased acute kidney failure risk by 33% in patients with kidney disease or diabetes. Excess phosphate can accumulate in the kidneys, leading to kidney stones and tissue damage. What diabetics need to know. Avoid overusing laxatives. If necessary, choose non-phosphate laxatives to minimize kidney risks. Increase fiber intake naturally from vegetables, flax seeds, and avocados instead of relying on laxatives. Stay hydrated but avoid consuming excessive amounts of water at once to prevent kidney strain. Control blood sugar levels, as chronic high glucose can slow bowel movements and worsen constipation. Rather than depending on laxatives, diabetics should focus on diet and lifestyle adjustments to support digestion and protect kidney health in the long run. 7. Metformin, a double-edged sword for diabetic kidney health. Metformin is the first-line treatment for type 2 diabetes. It reduces glucose production in the liver and improves insulin sensitivity, making it highly effective for blood sugar control. But is metformin completely safe for the kidneys? The answer is more complicated than most people think. How metformin affects kidney function. Metformin is primarily excreted through the kidneys. If kidney function declines, metformin can accumulate in the body, increasing the risk of lactic acidosis, a rare but life-threatening condition with a 50% fatality rate. A study in the New England Journal of Medicine found that diabetics with an eGFR, estimated glomerular filtration rate, below 30 milliliters per minute should avoid metformin due to the risk of excessive drug buildup. Additionally, metformin reduces vitamin B12 absorption, leading to anemia and nerve damage. A 2022 study revealed that 20% of long-term metformin users suffer from B12 deficiency, increasing the risk of diabetic neuropathy. Who should be cautious with metformin? Chronic kidney disease patients. If eGFR is below 45 milliliters per minute, dosage adjustments and frequent kidney monitoring are essential. Patients at risk of lactic acidosis. This includes those with heart failure, chronic lung disease, or liver disease. Individuals with B12 deficiency, diabetics experiencing numbness, tingling, or memory issues should monitor B12 levels. Safer alternatives to metformin. Some studies suggest that berberine could be an effective alternative to metformin for blood sugar control without harming the kidneys. Additionally, low-carb diets and intermittent fasting can naturally improve insulin sensitivity. Metformin can be a powerful tool, but without proper management, it can also pose hidden risks to kidney health. The key is understanding your condition and adjusting your treatment plan accordingly. Will you let your kidneys be silently destroyed? Now that you know about 7 medications that could be silently damaging your kidneys, the question is, will you take action, or continue to risk your health? Millions of diabetics take these drugs daily without realizing the consequences. Don't let yourself be the next victim. I challenge you to check your medications today. How many of these drugs are on your prescription list? If any, talk to your doctor about safer alternatives for kidney protection. You deserve better health, without sacrificing your kidney function.